Hey, welcome to my YouTube channel again. We want to look at another important topic at this time. And what we want to look at now is abdominal colic. Abdominal colic. At the birth of every child, parents of the child are happy about the arrival of the new baby. At the same time, they are worried with the different things the child will be expressing and exhibiting, one of which is constant crying. And then it has been observed, studies have shown that some of the constant crying of the children is not as a result of hunger, it's not as a result of wetness of the diaper, but it's as a result of a challenge the little child is having in the abdomen, and that is abdominal colic. And this abdominal colic gives almost all parents challenge because of lack of understanding on how to manage this abdominal colic. It is not the fault of the child, and that is it the fault of the mother. Studies have shown that this abdominal colic comes as a result of the unwinding of the intestine of the child, or the intestinal tract of the child, as it is uncoiling and expanding. The child feels the discomfort, and that is what is known or has been termed as abdominal colic. And some people ask, what is the cause? There is no known cause of abdominal colic, but there are some things that can aggravate it, and we're going to look at some of those things here, and we're going to look at some of the myths and the realities that people have held over the years about abdominal colic in infants and in children. Now, some people have said lactose intolerance leads to abdominal colic. Not necessarily true, but we have observed that the ingestion of lactose from the breast milk, can, trigger abdominal colic, but it's not a cause. All right. Now, when there is much gas in the stomach or in the intestine of the child, it tends to aggravate the colic, but that is not the cause of the colic itself. One of the myths people hold is that babies who are fusy or cry are not as healthy as other babies. That is not true. Every child, whether those that have colic or those who don't have colic, will cry. And those who cry as a result of colic doesn't mean they are less healthy than those who don't have colic and who don't cry. So, except there is another established ill health, a child that has colic and that doesn't have colic are the same. Some people, there is another myth that is held that changes in diet cannot help with the crying and colic. That if possibly those who hold that lactose intolerance is a risk factor for colic, they hold that changes in diet might help. But yes, it could help in reducing the gas, but it cannot stop abdominal colic. Another myth that people hold is if the baby seems uncomfortable, crying and freezing, food will help. It is not true. A child that has colic will not be comfortable even to eat, so food will not help that child. But there are some ways you will be able to help the child that has colic. And one of the ways to help a child with colic is trying to gently massage the stomach, from time to time. Again, do a kind of exercise for the child. Fold the leg towards the knee side, up towards the abdomen and back. Fold the leg again towards the abdomen and back gently. This will help in removing some of the gas in the system that aggravates the abdominal colic. For me not to bore you with much video, I'll leave a link below this video. Follow it and read more on abdominal colic so that you'll be able to be well informed on how to manage abdominal colic and some of the myths and realities about abdominal colic. I want to believe this video will be helpful to you. Thank you for following us. God bless you.